I'm Alan Spitzer. I'm Senior Vice President for Research, Education, and Quality at Mednax. I think the Center for Research, Education, and Quality is one of the most interesting aspects of Mednax, originally Pediatrics Medical Group. Physicians really need the ability to practice in an environment where they know their outcomes, where they can rest assured that their outcomes are as good as anyone else's, and so our quality improvement programs emerged out of that. They wanted educational opportunities, and so we have both our online and our in-person live conferences that we put on each year. And then lastly, I think they want to be reassured that they're still on the cutting edge of neonatal practice, and that's where our research programs come into play, and physicians have the opportunity in the company to participate in research in a large number of ways. So these various aspects of Mednax, both Pediatrics Medical Group and American Anesthesiology now, I think address the issue of the needs of the physician much better than any other company that emerged in the 90s, and I think that's been a big part of the success of this company.
I'm Catherine Grichnick. I am a cardiothoracic anesthesiologist, and I'm the current Director of Research, Education, and Quality for American Anesthesiology at Mednax. So as the director, I always have to think, what is the reason that we are here? Well, the reason we're here is to take great care of the patient. And we use the Center for Research, Education, and Quality to achieve that goal. So education, research, quality, and I'm going to add safety as the 4 pillars of how we influence taking great care of the patient or better care of the patient. We have a quality database that we gather about many of our patients, and we can generate quality research out of that by looking retrospectively at our data and finding things out about ourselves, both opportunities to do better, but also to figure out risk about different patients, and then perhaps modify that risk after understanding the profile for a certain patient.
What Mednax has done through its management programs and through the founding of the Center for Research, Education, and Quality is, in essence, create a third pathway by which physicians don't have to go into an academic practice to participate in research. And lastly, I think one of the issues that most physicians and nurses want to know is, how are we doing by our patient population? Are we doing well? Are the patients doing as well as anybody else can do in those clinical conditions? And I think what we've developed in terms of the tools that we've enabled our physicians and nurses to use, such as the Clinical Data Warehouse and the Baby Steps program, allow them to recognize how they're doing and to initiate quality improvement projects that put them second to none in medical practice in this country.
We provide education in distance formats, in live formats. We bring education to them. We send people to educational programs, and we will do one-on-one training, one-on-one coaching, or even skills-based training where we teach people how to do a certain skill, especially if we have a new surgical procedure or a new piece of equipment shows up in our hospital setting. So we have a broad swath of education that we try to appeal to every clinician and to appeal to their individual needs so that they can use the new kinds of research that we generate, but also basically keep up to date with every new kind of procedure, technique, and drug that comes out within healthcare.
I'm Dan Ellsbury. I'm the Director of Continuous Quality Improvement for the Center of Research, Education, and Quality. I function as an educator and as a designer of quality improvement initiatives to help our clinicians be able to improve their care, to show them ways and techniques to improve their outcomes in their patients. We took a very systematic re-engineering approach to how we provide care, and we termed this the 100,000 Babies campaign, and provided a pathway for them to change these things, to re-engineer what they did to get the outcomes that we wanted. We've seen decreases in infections, we've seen decreases in intestinal problems, we've seen decreases in mortality. So everything is going the way we were hoping it would go. And so at this stage, we're trying to continue all these things that we're doing right now, and also dive deeper into some of the more problematic areas and figure out how can we impact care more, what else can we do, what things should we be targeting, how can we help our practices get better and better and better.
So as we look at our quality programs, we really look at it as a continuous flow. And it really all starts at the bedside with the physician taking care of the patient.
It allows us to improve the outcomes for patients in this country, not just our patients, but patients throughout the country in a way that I think no one else can.